I know I didn't get to say hi to everybody, but we got to get rolling. Welcome to Unit 2, Lesson 8. So as usual, please go look for the tasks to complete for U2L8. You can find it either under Assignments or on the Disease and Public Health Canvas homepage in the weekly calendar table. Just look up today's date. Today is the 26th, so just scroll down to that. Goal today is to wrap up our discussion on the human immunodeficiency virus and move on to two more quick ones, bigger ones I want to talk about, specifically rabies and Ebola. And then this is it. We will be taking our test in Unit 2 the next time we meet on Wednesday. So again, you can see everything that we want to do on the tasks complete list. Look good. And it looks like everyone used their multiple attempts to make corrections if you needed to. But were there any questions you were thrown off by or confused by or wanted to review? It was the Gladwin reading on hepatitis B and HIV. Feeling good? All right. So a lot of you I know are already familiar with this, but in case you aren't, I want to quickly remind you on Canvas, some interesting resources. If you go to our Infectious Diseases and Public Health Canvas homepage, I've been getting questions a lot about where are like video recordings of class or the tasks to complete or the homework announcement. And I try to house all of that in that weekly calendar table. So if you go to the homepage and scroll down where it says weekly calendar, you can see in the columns every single day by date and lesson. The link there to the plan, the plan is the tasks to complete page, and there's usually a video link as well. So if you're ever looking for those, you can find them by date and by lesson. I've also been getting questions about grades. If you click on the grades tab over here, I would have to go into student view for, I don't want to show everyone's grades, but if you click on that, it'll bring up a transcript of your assignments. It shows you what's missing. It shows you comments written by me. And if you scroll all the way to the bottom, you should be able to see your grade as it currently stands and as it will be reported later this week. So, and let me know again if you've got questions about any of that. Okay, I want to wrap up our discussion on HIV by touching on my experience a little bit with it, which is I was a Peace Corps volunteer in the Gambia. It's a tiny country in West Africa. I lived there from 2008 to 2011 in a rural village. There's a photo of me with my host brother, Omar. And the president of the Gambia at that time was, he was casually known as Yahya Jammeh. His full title in a typical African dictator fashion was His Excellency Sheikh Professor Alhaji Dr. Yahya Abdul Aziz Awal Junkung Jammeh Nazruddin Abdili Mansa, which is pretty crazy. He has since been banished from the country, but amongst many crazy things, he claimed to have a cure for HIV, which he had made with sort of a little concoction of roots and berries and things like that. So I wanted us to just watch together a short little video. It's about 2 minutes long, a little over 2 minutes, of Gambian reflecting on their experience with this. So I'm gonna maximize off to my screen share. Here we go.
Fatou Diatta is HIV positive. She was one of the first HIV patients to be treated by...
I'm curious, is everyone getting audio through, or do you need to go through my speakers? Need verbal confirmation. Is audio coming through?
Audio is coming through. Yeah.
Awesome, cool, okay.
Former Gambian president, Yahya Jammeh. This is Diatta with Jammeh, as she entered the clinic back in 2007. There's no cure for HIV and AIDS, and yet the former president of Gambia said he could heal infected patients.
Very bad.
Jammeh has a high school degree in biology.
It was a disaster. Some died during the treatment, some died after discharge.
He gave Fatou Diatta herbal potions he mixed himself with milk or boiled water.
It was bitter.
The treatment lasted 9 months.
Believe me, I automatically come weak because I was not used to herbal medicine. And during that time, you cannot just leave, because if you leave, it's another problem for you.
Jammeh was accompanied by military men who made sure the patients took their medicine. Eventually, he discharged her, saying she was cured. In fact, Diatta was close to dying. Medical doctors gave her antiretroviral drugs to fight the illness.
See how big it is.
Take a deep breath.
Yahya Jammeh and Health Minister Tamsir Mbao experimented on hundreds of HIV-positive men, women, and children. In 2007, the former Gambian president showed Al Jazeera how he cured them. That man has since died.
Most patients treated by Yaya Jammeh are now dead, buried in cemeteries like this one. Only 2% of the population is HIV positive, but doctors believe the rate of infection is much higher. People were scared to talk about the illness, fearing that they would end up in one of Yaya Jammeh's clinics.
Hands-on Care is one of the few HIV and AIDS clinics in the country. Here, patients come for care and to get antiretroviral drugs. Some say Jammeh's claim he could cure HIV has been a major setback in the fight against the virus in Gambia.
He was lying to the country. If you tell people that you can cure them, and along the line they die, to me, he was just fooling us.
Fatu Jatta still wonders why Jammeh was so fascinated with HIV and AIDS. Did he believe in his herbal treatments? Did he try his own medicines? Questions the ex-president in exile is unlikely to answer anytime soon.
All right. So what I'll do now is again throw us into breakout rooms just for 2 minutes. I'm going to have you address the question that is in the red text there on the tasks to complete list. I'm going to throw it in the chat right now as well. Here's the question to consider. How could false claims about curing HIV made by a political leader complicate public health efforts to assess and prevent HIV in that country? Breakout rooms are open. We'll come back together in 2 minutes.
While you do surgery, so the plan was to shut it down long enough for the immune response to come in and clear the virus.
It's worked only twice here in the U.S., 18 times around the world, according to Dr. Willoughby, who came up with the protocol. While rabies deaths are rare in the U.S., only a handful of cases annually, around the world, the virus kills about 60,000 people a year. It's nearly always fatal, unless a rabies vaccine is administered in time. For Riker, it was too late for the shots.
That's my buddy. He's my boy. He's my everything.
And this morning, his family is holding on to hope that he will become the third person in the U.S. to beat the odds with this experimental treatment.
All right. That is an older report, though, and you can go look up the article. Unfortunately, that young boy did not survive. The treatment did not work. And further research, again, looking into what's called the Milwaukee Protocol, yeah, they largely say that it is a failed treatment. However, I'm going to pose another little quick breakout room question for you to consider. Throw it in the chat so everyone has reference to it. But again, it's also in the task to complete. Here's the question. Though this is now considered a failed treatment for rabies, is it still worth this administering to people who have been infected? Why or why not? Okay, we'll come back together in 2 minutes. You should be with somebody new. All right, Rory, what did your pair think?
We kind of talked about like if it's too late, like if everything else is too late, the anxiety kind of go into the brain. Just why not give it a try? Because if you don't do anything, you know what the answer is going to be. So just like, why not try everything you can before you like have a kid die or something?
Mm-hmm. Yeah, like there's a chance. I think it's worked twice since its implementation in 2005 in the US and supposedly like 15 times around the world. So yeah, so limited, but there's a chance. Margot, what did your group talk about?
We kind of got to the same conclusion that like there was no other feasible treatment after the point of like vaccine can't be administered, so it makes sense as like a last-ditch effort. We also kind of talked about what minor versus major brain injury was because we were just trying to like understand that, so kind of went in that direction.
Yeah, well, and it's interesting that, again, I'll post this video, but these studies of the symptoms in humans, and this is what really gets me, is that, yeah, it's the brainstem that really gets damaged. But otherwise, yeah, aside from just an inability to swallow and some weird, like, aggressive behaviors, as far as they can tell, you're conscious. you're aware of what's going on. Like you want water and you're thirsty, but you're suffering all these other symptoms, which to me sounds scary and unpleasant. So with that in mind, what is another potential benefit of inducing coma in people who it might be too late for?
I'm not having to go through that.
Yeah, those final symptoms and that suffocation is not something you would have to consciously experience. And so to me, I think that's just another, especially with young children and stuff like that, another good reason to at least try this type of treatment. So, but anyway, I think it's really fascinating. It's a virus that infects your nerve cells, and sort of makes sense then that inducing coma would slow it down enough to allow our immune system to contract it. But what they think, or the papers that I've read, are that the people that it has been successful in either had a very minor, like an already weakened form of the rabies virus, or they weren't exposed to very much of it, or it was in a very early stage or something like that, they essentially kind of just got lucky. Any other questions or comments on that? Yeah, Bill.
I have a question. Do you think if they like practice the induced coma more, like there would be a higher success rate of like the chemicals working?
Yeah, that's actually a good question. Like I don't know how much actual clinical experimentation they've done with this, because it's really been sort of like this like last ditch, like let's just try this method. So yeah, I don't know how much there were two medicals, I think ketamine, and there's one other one that's often mentioned. Those are the two that they use. And then they try these antiretrovirals. They try exposing you to weakened forms of the virus. And so, I don't know how much variation there's been, or if they were able to kind of keep experimenting with it, if they could get it to be more successful. I don't know. Everything I'm seeing is indicating that it doesn't quite work. That they're calling it a red herring, and that a lot of people are like, oh, good, like it really made sense, but apparently it's just that it's a little more complicated. It's a good question. Has anyone here ever seen a rabid animal before? Anyone? It was a big risk. Again, when I was in the Peace Corps in West Africa and the Gambia, their rabies was present. I saw a rabid cat once that had to be killed in our village. But we were all vaccinated against it, and they were the most painful shots I have ever had. You take 3 shots, and all they really do is just buy you more time. That if I was bitten, I was in a really rural part of the country, and so if I was bitten, it was going to be a while before I was going to make it to a medical clinic that could give me more up-to-date vaccinations to potentially help my immune system fight it. So those kind of vaccine shots were more just to buy time. I remember them being super, super painful. So my parents, again, my dad worked for the United Nations, and my parents lived in Africa for a long time. We had a gardener apparently when I was a little kid who had been bitten and didn't think anything of it, started to develop symptoms. And it was just, they said it was really hard because there's nothing you can do once it's sort of taken effect and the symptoms start. So it's kind of scary, again, that it has that highest fatality rate. But again, avoidable by just being wary of animals and vaccinating pets in particular. There's been such a huge campaign for that, especially in the US. And so it's very unlikely the exposures in the US now are way down. All right. Anything else about Rhabdoviridae? And again, that name too, rhabdo, literally refers to rage, because that is one of these weird symptoms of this aggressive, fearless behavior that it induces, but it assists in the spreading. So, okay, then we're going to move on to another big one that I know a lot of you probably heard about in the news, which is Ebola. Before we start on this, though, I'm actually going to have you do a little reading. So on task number 4 on the list, there is a link to an excerpt from a Richard Preston book. He wrote bunch of stuff related to pandemics. This is an excerpt from a book called Crisis in the Red Zone, which is all about the 2014 Ebola outbreak and the history of Ebola. It's just 3 pages, and it's a documentation of one of the first sort of real close studies in a hospital of the symptoms from September 1976 in a nun that was working in a Catholic mission in Zaire, which is now the Democratic Republic of the Congo. So there is some graphic medical descriptions, but it's worth kind of reading through to see what this does to you. So I'm just going to time for 5 minutes and let you read that. Again, if you click on the link right there, it should open up the reading. So I'll just time for 5 minutes to read through that. Go for it. Filoviridae family, and that's it means filamentous because they have this sort of stringy appearance to them. It's another RNA virus, actually very similar to rabies, negative, helical, and so on. It replicates in the cytoplasm, doesn't go anywhere near the nucleus. This one is not zoonotic necessarily. It definitely does, it exists in some kind of animal reservoir, but they actually don't know what that animal reservoir is. It has been known to infect both humans and monkeys, and so there's definitely something to do with primates, but it's jumping into them too from something else. It's transmitted through secondary contact, and so that's the main thing, is exposure to infected body fluids, but it could even be like skin to mucous membrane, meaning if you were to touch the skin or the sweat of that's infected on a living person who's infected, or a dead body that has died, someone who has died from Ebola, and then touching your nose, touching your eyes, touching your mouth, it will transfer into you very quickly and easily. In very rare cases, it's been airborne, but if you've seen images, and you will see images very soon of workers who have to deal with bodies and the sick, they wear full-on protective equipment because it is just so easy to contract this just by bodily fluids, even again, saliva coming out of the mouth. That's the airborne aspect, I think. It is mostly confined to sub-Saharan Africa and West Africa, but it has jumped into Europe and America a few times, but it's been treated very quickly. And as we discussed before, this one hasn't really jumped into pandemic level just because it kills and causes severe symptoms so quickly that the sick become isolated automatically. So, but the average death rate, not the death rate is 50%, which is pretty scary. So the progression, it can take anywhere from 2 to 21 days after exposure for it to finish incubating, but then you'll start showing those first symptoms of just abrupt fever, headache, weakness, but then, yeah, it graduates into abdominal pain, diarrhea, the vomiting, hemorrhagic vomiting and diarrhea. There's even, again, they note here, bleeding from the nose, mouth, anus, right? Everything's just hemorrhaging on the inside. The cause of death is usually multi-organ failure, just because you're losing the lining and blood pressure's dropping, and again, not a pleasant experience. So in terms of prevention and treatment, there is actually now, as of December 2019, a vaccine for one species of Ebola. They call it Ervebo, and it's a single-dose vaccine. It's protective against what they call the Zaire Ebola virus species, but unfortunately that's not the only one that is now causing outbreaks. But that's a pretty big development, and so it's promising for other vaccines that will hopefully be available. There is unfortunately no treatment. So once you begin showing symptoms, really all they can do is support you through that. It is possible to recover. Some people, again, after having the diarrhea and vomiting, will show signs of improving. But again, that's about 50% of the time only. The issue is then, if people are dying from this, you have to dispose of the dead infected bodies immediately, right? Either in sealed body bags or by incineration. And this is where they're having issues in sub-Saharan and West Africa, because this conflicts with the funeral culture, the rituals that they have out there. In a lot of sub-Saharan and West African cultures, funeral rituals include relatives and friends visiting, touching the body, paying their respects, even eating in the presence of the body. And so that's the next thing I want you to consider for our last little group discussion here. This was something else I was going to do. But so how would this be a problem? If it's customary to touch the body, to sit with the body for like a day and have it presented, this is going to cause spreading of the disease, right? And so I've got one last video to show you here about this culture clash, and we'll discuss how it could be addressed. We're optimized for video. Yes. Okay, here we go.
The Ebola outbreak has now spread to a 6th country in West Africa, with one case now reported in Mali. Liberia remains ground zero, with half of the Ebola deaths in the world, more than 2,700 there so far. The dead are highly contagious, so the government has made cremation mandatory. This is the glow of bodies burning each night outside the capital, Monrovia. Deborah Pata followed a burial team as it combed the countryside.
Life was hard enough in Kakata before Ebola. Now it has one of the highest infection rates in the country. It's feared this woman's brother died from Ebola, but she's not being allowed anywhere near the body. The villagers too say their farewells from a distance.
How was it like today?
Government worker George Warrior briefs the burial team he's brought to the village to help remove the body.
People touch the body while crying. They cook, they eat and sleep together for 1-2 weeks before burial. And now we are saying, don't allow the body to be there for 24 hours.
The new rules don't go over well. Sometimes villagers hide bodies or bury them in secret to avoid the government. Even now, this dead man's widow emphatically denies her husband died of the virus, despite the fact that Ebola claimed the lives of both his mother and sister. After a long walk into the bush, the burial team begins suiting up, following strict new guidelines. Frida Forkpa was studying to be a nurse before the outbreak, but she jumped at a chance of a job. She makes $15 a day.
I'm proud to be part of the burial team because I was the first female that joined the team.
Are you not scared? It's the most dangerous job in the world.
No, I'm not afraid.
The team discovers that someone has covered the body with a blanket, which also means someone may have touched it and could spread the disease further. But nobody will own up. The body is unceremoniously packed away in a double-layered protective bag. The team sprays chlorine everywhere. Then they move back toward the village, stopping several times along the way. The body is just too heavy. Devastated villagers are only given a glimpse of the shrouded body, then a ruthlessly efficient burial. Every piece of contaminated clothing thrown in with the corpse. But inside that chlorinated body bag lies a man who was loved. Felicifer Chepas, who delivered coal for the villagers' stoves, was just 22 years old.
So it's an interesting problem. Did everyone hear that, again, because they have this very sort of sanitized disposal of the body, it's very quick, there's no ceremony or anything like that. What were some families doing if they had a relative that they suspected died from Ebola?
They hid the body.
Yeah, they're not reporting it. They're hiding the body, they're doing it themselves. And that is really complicating things for the medical response for something like Ebola. And so, again, we're running out of time. I was going to have one last discussion, but do you see any way of reconciling this? Like, what could these organizations try doing to try to reconcile this? Any ideas? It's kind of a tough situation, right? I think just educating people about the dangers of it. I did see a very interesting report where basically they've started now in parts of Liberia to basically set up these like safety tents where it's this isolated zone where they could bring the body in and put it on a little ceremonial bed, and people can still come in to pay their respects, but everything's behind a plastic shield, everything's sanitized. They've even have those, like, everyone's seen those like weird glove sleeves you can like put your arm through, you know, so you can like touch things on the screen and then take them back out again. They've been using things like that to try to still give these cultures the opportunity to do their burial rituals, but still get rid of these bodies in a sanitary way. And it's been actually really successful because now you don't have that fear anymore of families hiding bodies, not reporting deaths from this disease. Because yeah, it's upsetting to have a team of people dressed in this white, protective suits come take the body, remove it, bury it, or burn it immediately. And so there's been success now with sort of respecting the culture and taking that into account and allowing it to, but still keeping things sanitary. And that's kind of one of the biggest things with public health. Again, last story I'll tell from my experience in the Gambia, but the Gambia had a big problem with what's called FGM, which is female genital mutilation. It's basically circumcision for females. They slice off the whole front part of the vulva. It's a really not safe thing to do. But it was a big cultural thing in a lot of the tribes. And there was an organization in Gambia that was trying to work to prevent this from happening. And the most effective way to do it was to essentially still allow them to have all the rituals, all the customs, to do the ceremony, to even have the moment, right, where they would actually perform the circumcision. But right in that key moment, don't actually do any cutting, right? Pretend to do it or just do something else. And that was one of the most effective ways, where they weren't just saying, stop this ceremony, it's unsanitary. It was more just like, you can have your ceremony, you can do the cultural significant thing, but then this one little step is what you're leaving out. And so there's been successful with public health efforts, but again, respecting the culture and keeping that in mind. So it's a challenging thing. All right. Any other questions or comments on Ebola stuff? All right, kiddos, that is it for me. Homework is just a short reading from Gladwin on Ebola and rabies, and there's a notes and a quiz, but otherwise the next time we meet, we will be taking the Unit 2 test. It will be very similar to the Unit 1 test, open notes, probably about 75 points. I don't quite have the study guide review slides ready yet, but I will have those done by the end of today, so all that will be posted and up, and you should be good to go. All right, thank you very much. Have a good day. I'll hang out if anyone's got any questions.
Bye, thank you.
Thank you.